Welcome to the Stereotactic Academy, an e-learning resource for neurosurgeons and neurologists under the auspices of the WSSFN. Stereotactic neurosurgery and deep brain stimulation have revolutionized the treatment of movement disorders and is expanding rapidly. Today, the indications and targets are numerous, and new technical advances are making the procedure better, but also more complicated to master. And there are large variations in the penetrance of DBS around the world, a large unmet need, and a lack of well-educated neurosurgeons, neurologists, and multidisciplinary DBS teams. For that reason, we have created the Stereotactic Academy. This is an internet-based e-learning resource intended as a complement to the traditional methods of learning. The resource is providing clinical knowledge, how to do DBS, and the material is completely free, easily accessible, and requires only an internet connection. Our goal is to provide a more extensive material that can be fitted into normal courses and to reach colleagues with limited access to our traditional educational tools. The webpage was put online in 2018, and the content seems to be appreciated among the more than 1,500 users. We are also working outside of the traditional channels, reaching young colleagues around the world. We are now covering almost every aspect of clinical importance, and you can here start at the most basic level and work your way through the lectures and courses to a very advanced level. You will find more than 200 lectures from the leading experts in the field, organized in a structured manner, guiding the user through every aspect of the procedure. We have basic surgical lectures and courses, such as how to implant a DBS system, perform a radiofrequency lesion, or make a biopsy, as well as lectures on more advanced topics. We are covering how to calculate coordinates and how to identify common as well as uncommon brain targets, all explained in a stepwise fashion for application on your own patients. And you get access to downloadable cases where the user can do the targeting according to the instructions in the lectures and then compare with our suggestions. For the neurologist, we cover both common and uncommon indications and will look in detail at patient selection, evaluation, and management. And of course, you will find a plenitude of lectures on various aspects of programming. So please have a look around the Stereotactic Academy at stereotactic.org and see if you can find anything of interest for you or for your junior colleagues or other members in your team. Thank you.